I can see our next speaker, Dr. Mariam, is on board. So firstly, I want to welcome Dr. Mariam. Dr. Mariam,
Hi, good afternoon. Welcome.
hi. A lot of you guys will know Mariam from Instagram. Please do check out her Instagram profile. Put her links out in the chat going forward. She does some amazing stuff, not just medical based, but life based as well. UK life based as a doctor for an international medical grad. It's so useful to see that type of platform. So if you haven't heard of her before this, then hopefully you can go and follow her. After this, she's a CT2 core trainee 2 in psychiatry. She's got lots of interest around the field of psychiatry and mental health itself. And like we said, she uses social media to share some really, really important things going forward. So welcome to Dr. Mariam. I am going to
Thank you so
hand it
much.
over to you. Thank you so much for giving up your time on a Sunday.
So, a little bit about me. I graduated in 2018 from Pakistan, and then I gave my PLAB 1 exam during my internship, and then gave my PLAB 2 exam right after when I finished my internship in 2019. And then there was a COVID period that just landed on us. And I got my registration in January 2020, but I was stuck in the pandemic from January till October. If any of you already follow me on Instagram or YouTube, you know that I have posted a video, like I got like 11 interviews, but unfortunately because of COVID there was like red areas that you can't fly, this and that, so I was stuck there till October. I started my first job in NHS in October 2020, and that wasn't in psychiatry, it was in surgery, because I wanted to do surgery. And that was my first and foremost reason for coming to UK, because I wanted to do surgery. So I landed in my dream specialty at that point, that was surgery, and started doing surgical non-training job. It was a very sportive environment, very nice trust, and I made loads of friends. But I left surgery because technically I never did surgical training or non-training before this job, other than what I did in my internship. And in internship, life is very different than when you experience it from a training point of view. So when I started doing, I did it for a year and a half, and I realized that it's not my thing, because I wasn't finding that happiness in the theater. My whole process of being in the theater was, when can I go out and communicate again with the patient? So I realized that the reason why I like surgery in the first place was not because of theaters, but because of that feeling of helping somebody and then seeing them being helped. So that was the reason why I really wanted to do surgery. So then I realized that that's not really what I want to do. Yeah, and then that's when I decided, like, it's not my cup of tea. I need to like look for other specialities and see what I really want to do. So I started exploring other specialities where the patient interaction was more, um, in a way. So I did like 6 months of medical rotation, and I realized that actually surgery is not what I want to do. So then I was like, what I want to do. So I did a tester weekend in psychiatry with a friend who was like on call. And I really liked it. I actually like the concept of being there for the patients. And that's what I really wanted to do with my life. So then I gave my first MSRA exams in 2021, and that was second round. I got a job offer that I did not accept because I wanted to stay in South, and because South was where I landed in the first place, it was near London. So I did not accept it, and I was like, I'll do it another round. So I did again in first round in 2022, and I didn't get any offer in the first offers that come out. I didn't get any, and at that point I was like, God, I just need job anywhere, wherever. I don't care. I just need a job. But when it got upgraded, I got job in North. It was not in South again, but obviously I don't want it to wait anymore, so I accepted it, and I absolutely loved it here. So if you are one of those who are really scared to move places, you never know how much you're gonna like it until you move. Um, then I started my CT1 psychiatry in August 2020. Oh, 2022. Sorry, I wrote it wrong. So it was last year. And now I'm CT2 psych trainee, and I am doing psychotherapy at the moment as a rotation. That's a little bit about me. Now, why I joined psychiatry, a few things that I already mentioned, but I really, really like spending time with patients, and that was the kind of specialty that I wanted to do. Is there is a misconception about psychiatry that it's a lot of talking. It's not. Psychiatry is a lot of listening as well. You have to be patient. You have to have that stamina of being there, just being a good listener. Communication is a part of it, obviously, but I have met a lot of people who say we are not very good at talking. What should we do? If psychiatry is what you want to do, you'll learn with time how to communicate, how to bond up with patients. But if you're not, if you're one of those people who can't sit down and listen to somebody continuously for 1 hour, it's not a good or bad thing. It's just a type of personalities that we all are different. If you are a type of person who wants to rush between patients, who like that adrenaline rush and want to change situations in every 10 minutes, like running between patients, not in a way of rushing, but you like the change of situations, then psych is not the right place. But if you are one of those who really want to be there for hours and just like sitting there, like knowing about them, helping them out in a way that you can't even imagine how helpful it is just by being there for those who never get help or support from anywhere else in the society, then yes, psych is the specialty that you should consider. Not any two patients are same. So now this is very interesting. A lot of people think psychiatry is a very boring specialty and you will get bored. For me, I it's my one. I have done like CZ1. I never met any two patients who are exactly the same. They all are different, like me and you. We all are different. We all have different backgrounds, different stories, different lifestyles. It's the same. And of course, work life balance. I got 2 kids, and one of the reason why I switched from surgery is I really respect those people who are doing this, and I appreciate them and adore them, but it was not my thing. I want to finish work at time, want to come home at time, have my work at work and life at work, life at home. I can't mix both things because for me, I'm more than being a doctor. I'm me. I'm just myself, and I want to enjoy my life. So the work-life balance I got in psychiatry is amazing, and the environment is so supportive. You get weekly supervision that most of the specialities do not offer. You get weekly balanced groups. That's where you can talk with your psychiatrist, psychologist, and with your team and vent out your feelings. Then again, you get your educational supervisor very frequent meetings. I know there is educational supervisor, clinical supervisor in every specialty, but the amount of attention you get from them in psychiatry is actually immense. And then the mere understanding that I'm a human, I can have problems, and it's okay, is is huge for me in psychiatry. If I'm running 2 minutes late on daily basis and I have an email put on like I can't come at 9, I can come at 9:05, but it's justified and discussed with my supervisors and documented, everybody is happy with it because they make peace with this concept that you are a human and you got work and things to do. Then again, global opportunities. As I mentioned, I'm from Pakistan. So one of the things what I wanted to consider while choosing a specialty is a specialty that has opportunities outside UK. Because what if I have to move? What if I want to go back home? So psychiatry is one of the specialties that you can find jobs anywhere in the world. And the last and the most important thing is fighting stigma. There is still a lot of stigma associated with mental health. I use Instagram, and if you use Instagram, you would know how loosely we use the word delusion these days. And it just makes me feel so bad about those who are struggling with delusion. And we are not even finding anything wrong with it. You know why? Because we don't understand the term actually. And if we do, we don't understand the severity. It's the same with OCD, it's the same with psychiatrists are mad, it's the same with psychiatrists do nothing. There's a lot and a lot and a lot. But the good thing is the understanding about mental health and the 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 understanding that mental illnesses need to be treated is increasing on daily basis, and it's actually getting a lot better than what it was 10 years back. So there's still hope at the end of the tunnel. Yeah, and let's talk about then a few cons why what I think can be done, can be improved in this field is actually government funding. A lot of the time when you are in a psychiatric ward, you will be like, gosh, there's not even this basic thing. Yeah, because there's not enough government funding. And then a lot of the time, the wards are short staffed, again, because there's stipend crashes everywhere. But there can be a bit of better government funding, and that can improve the situations. Limited research. So a lot of the time, you will look at a phenomenon and you're like, okay, how this happens? And the answer is we don't know because it's not fully researched. It's not fully explained. Okay, how this drug works? Not fully explained, not fully sure, because there's very limited research in psychiatry. And again, that is to do with funding and obviously the interest that developed over years. How people saw this specialty 20 years back is totally different today. But that gives a positive aspect that if you are interested in doing research, psychiatry is a field where you can do massive research because there is huge that needs to be unfolded. And then there is a constant struggle to explain that I'm not a psychologist, and there is a huge difference between psychologist and a psychiatrist. And I neither psychologist nor can I read the minds. So this is a huge thing. Like often, like I meet people, even my own friends, and they're like, "Oh, now you know what we are thinking." God, I don't. That's not what psychiatrists do. So there's like a little bit of obviously the social stigma that you have to deal with it. Now, coming towards psychiatry training. So, psychiatry training is total 6 years. 3 years is core training, 3 years is ST training. There is a run through program that is for ST training only, and that's just for camps. So, if you're going for a ST training for camps, you can't actually switch to any other specialty later on. So, when you're applying on Oriel, be mindful of what you're applying for. If you're applying for the core trainee CT1 jobs, you can switch to any specialty, subspecialty after your core training. But if you're applying for run through ST1 camps, you can't switch to any other specialty. Then you have to do camps. Um, in core training, the 3 years of core training, you have 6 months rotations, six months rotations. Like I'm CT2 now, so I have done two rotations in my CT1, and now I'm doing my third rotation. After core training, you have to reapply for ST training. And to apply for ST training, you have to pass paper A, B, and CASC. And that's another horror story because the passing rate is quite low. But yes, still people pass the exam. Everybody is doing the exam around, and everybody managed to get a ST job. So, yes, they are hard, they are difficult. They need to be fully prepared. And of course, with the job, with life, it becomes a bit hard, but everybody eventually manages to do AB and CASC, and then you can start ST training. If you don't wish to start ST training, what else can be done is you can step out of the training and become a locum reg or trust grade doctor. But then, if you have to complete your training again, you have to complete your exams and then start your ST training. And then there are loads of subspecialties that anyone can choose from. We're going to talk about subspecialties. There is a question in the chat, I think, but I'm happy to go through the questions in the end. Can you tell about CAMS run through training? Is it for 3 years? No, CAMS run through training is not for 3 years. It's the same 6 years training. It's CT 1, 2, 3, ST1, ST4, 5, 6. So the training years are same. The only benefit of going for ST1 CAMS is you don't have to reapply at ST4 level. So in that you are going through a run through program of 6 years. Whereas if you are doing core training, you have to do 3 years of core training, then reapply for ST4. So that's the only difference. But if after doing 3 years of CAMS, ST training, you realize you don't want to do it, you don't have an exit option. You have to complete that training. Subspecialties in psych. So there are these few that we commonly know, that is adolescent and child, that's CAMS that we just talked about. There is a pharmacology, that's a sub branch that people go in: forensic, perinatal, geriatrics, and addiction. These are the commonly known ones, but there are a few others. Okay, I think I missed the slide, but there are 9 other minor subspecialties as well, other than these majors, that include the research, the subspecialty that includes research as well. So there are like actually loads of subspecialties, and depending on your interest, you can choose whatever you want to do. There's psychotherapy that's not in this list as well. That's one of the things that I am really interested in doing, and I might take up as specialty. You never know what you want to do in after 3 years, but yes, for now that is. Now, coming towards who can apply, anyone who is about to complete FY2 training or equivalent can apply. For IMGs working as non trainees, they can apply, but they would need a Crest form signed. You don't need any prior psychiatry experience. I didn't had any psychiatry experience, and it took me 2 3 months to understand things, to learn things, to understand the basic history taking and stuff like that. Because if you don't have any experience in psychiatry, obviously it's gonna take you some time to settle in the system. But you don't necessarily need experience to work in psychiatry as trainee. Of course, you should hold GMC registration before the start of training date, not at the time of applying exam. So when you're applying for MSRA, if you don't have registration, that's okay, but you need registration when you're starting training. How to apply is same multi-specialty recruitment exam. That's for some other specialties as well. Since the COVID landed, there are no interviews. There's still no interviews in 2023, no announcement yet of interviews. Previously, there used to be interviews, and for the interviews, you need a portfolio. You need to prepare for the interviews. But at least for this year, there are no interviews and no portfolio needed. So all you need to do is do good in the exam, score high marks in the exam, and then score your position. Um, if I take FY2 in UK, will I need to sign the Crest form? So if you do your foundation year 1 and 2 in UK, you don't need a Crest form signed because you're already doing your training here. It's for IMGs. The passing marks for psychiatry, we are just coming to it in a second. Timelines. So there are 2 rounds for psychiatry. The round one is for which the applications open in November on Oriel, and MSRA exam is in January, and training starts in August. This is the round that I accepted the offer after this round, the round one. There are more job offers in round one, and there are more available seats in round one, but again, there are more candidates in round one. Round two, the applications open around mid July, and the MSRA exam is in September, and the training start in February. That's the round where only the leftover seats are advertised, and if you're applying in this round, obviously the competition in a way is more because it's less seats and a lot of people applying for those seats. Competition ratio. Now, this is interesting. If you look at this is for 2023. Applications 2,610, post 524, and competition ratio is 4.98. This was 2 point something in 2021. So actually in last 2 years, the incline towards doing psychiatry is massively increased. This is a huge difference than what it was 2 years ago. 2 years ago, nobody, like a lot of people don't wanted to do psychiatry, or there was like a lot of stigma that is now a bit less, and a lot of people are applying, and of course the competition ratio is increasing. So the round two that just happened, I know the people got offers who have scored more than 450, 460. So if you are looking for a cutoff ratio, I would say it needs to be around 480 if you are looking for a job offer in a first round. But again, it depends a lot on upgrading. It depends how many people accept the offers, how many people reject the offer. But roughly your score should be around this. And why do IMG struggles? So IMG usually struggle because of the SGT part. I personally think this way, because the clinical part is always in all the exams. We managed to do PLAB 1, we managed to do PLAB 2. Yes, because a lot of it was clinical. Yes, PLAB 2 is a little bit SGT, but the SGT that comes in MSRA exam is a whole different world. And I know a lot of people, they don't actually really prepare for SGT because the one reason is we usually think, oh yeah, it's just a common sense question and we're just gonna pick one of those. It's not a common sense question. Just there are guidelines that we need to know, and we have to pick the exact guideline to pass the exam. So if you have got time, I would suggest reading the GMC Good Medical Practice Guidelines. They really, really help. And also if you are already working in NHS, that actually helps because your understanding about the system is way better. And if you are bound to a specific location, obviously that doesn't really help because depends how many jobs are and how many people are applying. But if you're open to the jobs, if you're open where you want to go, then obviously you have more opportunity to score a job. Tips and tricks, equal importance to clinical practice and SGT. Practice SGT. Don't fear the stigma that's associated with psychiatry. It's an amazing specialty. I love it. And I'm not bored if that's one of the things that you're scared of. It's not a boring specialty. And psychiatrists are not mad, surely not. Yes, we a little bit struggle with technical difficulties sometimes, but not mad at all. Okay, we got some time for Q&As now.
So thank you, Mariam, for that insightful talk, despite the technical difficulties. We'll go through a few questions. I think you answered a few of them as you were going along, but we're working to a tight schedule.
There's just one that I can say. How many attempts allowed for MSRA exam? You can do round 1 and 2 and even in the next year. There is no minimum that I am aware of. Correct me if I'm wrong.
There's no, there's no max.
Yeah, there's no max. How do you apply for testers? So for the tester week, you have to talk to your supervisor, and if your supervisor agree, you can go in that ward and do the tester week. It needs to be at least 6 months in advance. Other than a lot of people struggle with the swaps and things. But if you talk to your supervisor, if they're happy to assign you for a week or weekend, whatever, then you can do. I actually just did on a weekend because there was nobody ready to swap the week with me, so I just went on my free weekend to just see how things are. How can I apply after FY2? It's the same MSRA exam that we all have to do. What would be a difference in practice between a GP with special interest in psychiatry and a psychiatry training doctor? That's a total different worlds. That's like if I say I do psychiatry and then I do aesthetics. What's the difference in me and then a psychiatrist or then a aesthetic? So aesthetic doctor. It's like it's a huge different world. You can do GP and then do the special interest in psychiatry, but again, what subspecialty you're holding and what is your specialty? You are a GP doctor. So it depends what you want to do. It really depends what you want to do. And it's still gonna be 4 years, right? It's just 1 years of subspecialty, supra specialty with psych interest after GP. So it's still 4 years.
Before we jump in.
Sorry, Mariam. I think with the GP and specialist interest, it depends really. It's not necessarily an extra year on top.
Oh, okay.
But yeah, it depends on backgrounds. You can do diplomas and things. So it varies really, as Mariam has said, in terms of what subspecialty you want to do, whether you want to go into addiction, whether you want to go into CBT, whether you want to do different forms of psychiatry or you want to be Section 12 trained. So there's different options in GP, but yes, it is completely different to being a psychiatrist. And that's why we have psychiatrists. So there's a lot of interaction between GPs and psychiatrists because it takes up a good percentage of our consultations, unfortunately. So thank you, Mariam, a great insightful talk.
So much.
Really appreciate it. I know you've got a lot going on, so thank you so much for taking the time out. We really appreciate that. And hopefully we can grab you next year as well, because it was a great talk and there's been some great feedback. So thank you for taking the time out on a Sunday. So
that's
thank
okay.
you.
I'm so sorry for the technical problems, but hope to see you guys next year.
It's okay. Thank you, Mariam. Thank you so much.